why you should never make CBCT scan like this. The purpose why some clinicians do this is to reduce the radiation for the patient, to reduce the dose as patient get due the CBCT. But if we look on the scan, let's see here in anterior view and change the density a little bit. What we have? We have this area, but we put patient just in a quadrant. If your whole protocol is the same, you will not cut your dose in a quadrant. The dose as patient receive will be the same. So what happens if we put the patient like this? This is our mandible, and we actually align this mandible with the quadrant. But what happens if we can move a little bit our patient like this? Is it better? Of course, yes, because we will have more teeth for alignment, because we need to have triangle for the good alignment. So the first mistake, this is the put patient in the middle. But the bad thing here, this is also that the patient teeth will be close to the border of the quadrant, and it's better to have a little bit more area. But anyway, even if you have this area, it will be much better than putting the patient just like this, because you will not reduce your dose, but you have more issues when you make alignment. Let's see how alignment looks. Let's see the scan alignment. If we look at it, it looks quite good. But we couldn't measure third quadrant. We just can measure one of them. The aim of clinician was to make as low dose as possible, and also for the good alignment, he used high resolution of the CBCT. And what happened if we will have a little bit low resolution, if we put the standard resolution, but the bigger FOV? Actually, there will be the same dose for the patient, but we will have triangle for the good alignment. Why? I will not trust this triangle. So we can see that alignment is okay. With AI assistant is really easy. Let's do this manually. I'll then look into the segmentation. You see, even system recognize that this is not enough because this is not like a triangle. Okay, let's put more area here. Yes, it also looks quite good. So we can work with it. But what is the angle? Do you know, is there any deviation in this angle? Do you know where will be, in reality, the screw channel and the ambulation of the implant? No, because we couldn't check it in triangle. Let's make one experiment. I will open another case. And in this case, I have whole area. But what I will do, I will open segmentation. And I will create two different segmentation of the mandible. For example, like this. And I'll create the second one. I will call it mandible 2. And I will use as a source mandible segmentation. Then I will use the scissors and just segment this part. Now what we have? We have two different segmentations. Just a segment and a puncture. And let's try to align just with a segment and measure how what is the difference we have. So I start with AI assistance also. I'll go here. Yes, we can see that the whole area looks quite good. This arch has been aligned with AI assistant, the PLY file, and STL we align manually. Let's double click on it. And let's go back and click align to other object. And now we need to select the object, and our object is mandible 2. Let's check. Here, everything all right. But if we go to the other quadrant, so we have a little gap. And let's check in the cross-sectional view, because if we open it here, and you can see here that in the part where we align in the fourth quadrant, so here you can see that in this quadrant, both line looks quite good. But if we go to the other side, we still have here some deviation. How big it is? 0.5 millimeters. So is it big or not? 0.3. 0.1. So, and we can understand that our jaw, they're a little bit shifted. You can say that this deviation is not too big, but as I mentioned, that the radiation as the patient receives, it's not about the size. It's not about the side of the target of the jaw. It's about FOV and how big FOV we have, how big exposure we have, as much radiation patient receives. And if we target just in one part of the jaw, you will not have any opportunities. You receive your scan, yes, you can do your surgery, but if something happens wrong, you will need to make one more CBCT. And if you will make one more CBCT, there will be the double dose. The ITI guidelines, the ICRP guidelines tell us to use as low dose for the patient as possible, but we need to use the FOV as lower as needed. So in this case, if you just treat your mandible jaw, yes, you can reduce the slices and don't make the scan of the both jaw of the maxilla and mandible. Just make a capture of the mandible, but not reduce the size of this, because whole arch should be inside of the target, because you will have this issue. You also have an issue because of voxel size, because of the alignment, and you have a lot of issues, and you increase them more and more. Actually, normal implant placement, when you place the implant, you will have deviation 0.3 millimeters, 1 millimeters, sometimes 2 millimeters. And the literature tells us that this is normal. The clinician experience tells us that this is normal. And you will have also deviation here, and increase this. And what is the purpose? To make your case worstly. Actually, I don't understand it. Please don't make this small CBCT. Create the big CBCT, normal CBCT, and you will be in more safe position. If you want to reduce your dose, don't use the high resolution. Use the standard resolution. That's enough in most cases. Standard resolution, just the mandible jaw, but the whole jaw inside of the visible target. Because if you shift your patient on the side, you will not reduce the dose for the patient. The dose the patient get will be the same.